My God, this is so loud. It's not loud. Good evening, everyone. I'm AnnMarie Cronin, and welcome to our live weekly medical show on News Talk 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is here with us again to tell you what you need to know about how early screening and knowing your profile can lead to the avoidance of heart attack and stroke altogether. Pre screening and simple non invasive tests can actually prevent Alzheimer's and many other chronic diseases. If you have a question, we're opening up the lines and taking your calls. So please make a note of this number 800-859-0957. Again, that's 800-859-0957. We'll be repeating it throughout the show, but this is your chance to talk to the doctor directly. So stay tuned and we'll be right back. You're listening to News Talk 760 WJR. We're on Facebook Live.
Okay, yep, we should be on Facebook Live now.
What are we starting out with when we go back on the air?
Well, I want to lead into this legal brief
Yes.
that was written by the Attorney General of Nebraska.
So we're basically starting off with COVID.
Yeah.
Okay. COVID.
You've had enough?
Well, COVID and the FDA.
Well, no, I'm done excusing doctors for their position as a hospital employee for not taking care of people. It's just too stupid not to.
So, I mean, what you're saying is all these people that floated into the hospitals and got put on ventilators and died could have been treated.
Yes, should have been treated.
Ought to have been treated.
Yes, and we're not neglected. Failure to treat, willful neglect, whatever term
wow, I love
you want to put
neglect
on it. It's, I mean, I don't know if it's not treating somebody's malpractice. You know,
that's a good question. I don't know.
But basically, all these people have committed horrible malpractice. And you can't blame the government because the government doesn't treat people. Now, they did make it difficult, no question.
Mm-hmm.
They made it difficult. They threatened sanctions and legal action against doctors. We might be coming back any second.
Yeah.
Well, I basically think doctors shouldn't care because they don't work for the government. Welcome, all of you listeners, to our live weekly medical radio show here on News Talk 760 WJR. I'm AnnMarie Cronin, and we're back again tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that number is 800-859-0957. Dr. Kolender, always a pleasure to have you talking to the audience about what they need to know about being proactive and taking charge of their own health. What's the news of the week?
Well, the news of the day, because I'm going to say today, I developed a whole different opinion about COVID. I'm a little overwhelmed and sad, frustrated, and pretty angry about how COVID has been taken care of throughout our country since, March of 2020.
What is it that changed today in particular?
Well, my colleague in Chicago, who sends me research papers and summaries for me to review, sent me, and this is a document that was published in October, and it's a legal brief by the Attorney General of Nebraska. And this Attorney General was asked by the Nebraska Secretary of Health and Human Services what the state's legal obligation was toward handling doctors who were prescribing hydroxychloroquine and ivermectin,
Which
you know,
you were doing.
which I'm doing all the time.
And none of your patients died. None of them went to the hospital. None of
Correct.
them died. So they were all saved. So it's 100% plus plus.
That's
Same
that's
time,
my experience.
at the same time, I was hearing about people who went to the hospital and died.
The way to die from COVID is to go to the hospital.
Right.
If you want to die, get COVID, go to the hospital.
Well,
So,
and why were they not treating patients with hydroxychloroquine and ivermectin?
well, I want to refer the listeners to my Instagram account and my Twitter account, Kolender Medical, because I linked this legal brief to it. It's like 50 pages. It's long and it's not easy to get through, but it's a really good summary of the history of each drug, ivermectin and hydroxychloroquine. First its use as a drug in general medicine, and then its use in COVID. And I don't know that I could say what's in this brief better than the brief itself. But after reading it, or in the middle of reading, and especially the ivermectin section, which comes first, I am disgusted at how simple it is to prescribe this drug and how effective it is. That it's been made unavailable primarily by the FDA, and all of our other agencies have jumped on to kind of follow, the FDA's lack of leadership toward making it seem it was foolish for doctors prescribing this drug. And the same thing basically goes for hydroxychloroquine. And, as I'm reading this, and I really thought nothing of prescribing these drugs, I've been, they've been around forever. There should be no reason to consider their safety. That all these doctors who refused to treat patients and made them sit at home and die, or then go to the hospital when they were sick with COVID, when treating them early does the trick and keeps them out of the hospital.
Okay, wait, I'm gonna have to jump in here because we're gonna run out of time in this section. And I'm listening to you and I'm thinking about prior shows that we've had where you've admitted that you have given prescriptions to patients for hydroxychloroquine and ivermectin, and the big box pharmacy companies have refused to fill the prescriptions recently. But yeah, the proof is in the pudding that all of your patients who got COVID, you treated them as all doctors should be hands-on treating their patients. You were treating them with your cocktail of drugs, of which hydroxychloroquine and ivermectin were in that cocktail. None of them died. None of them went to the hospital. But the numbers that the hospital had, horrifying.
That, 4 million people went to the hospital and about 850,000 died. That's about 25% death rate going to the hospital, when most of those people, if they were treated early with either of those drugs under doctor's care, would not even have had to go to the hospital.
But question that I'm asking you is, when you go to the hospital, you're triaged, you get admitted to the hospital. Why is it that when you get admitted to the hospital with COVID, that you're not just observed? And why are the doctors there that are handling your care, why were they not giving ivermectin and hydroxychloroquine?
Well, I'm done making excuses for them.
But why didn't they? I mean, why that they're doctors?
Well, was it a matter that it was too late at that point once you've gone to the hospital?
No, if you go to the
Is there a
no.
timing? Okay.
It's everybody lives and dies, but what the FDA says, and the FDA made very confusing statements, and in a lot of occasions out and out said, this is a horse drug, a veterinary drug, and you should not be using it, even though it won the Nobel Prize for medicine in 2015 for saving millions of people at very low cost for a variety of different diseases.
Wow, amazing. I mean, this is like blockbusting. We'll have to come back and talk about this on the other side of the break. Again, you're listening to our weekly live medical radio show where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We are here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to prevent or reverse disease, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
You know,
Wow.
AnnMarie, it's really not that blockbuster. I hate to say it.
It is.
I mean,
It's very. Are you
well,
kidding me? Her friend died. Okay.
it's a blockbuster for me to say it because I haven't said it. But there's people online who've lost their careers, you know, who've lost their jobs trying to do this, you know, on social media. They've been canceled. They've lost their, you know, hospital appointments. So there are doctors who've paid the price for trying to get the word out.
But
And we
why? What is the underlying issue here? Why should people be silenced if there's an effective treatment?
because Dr. Fauci and the government, and this is why it's depressing, is that the forces of nature going against us, not just with COVID, but with prevention. And this is the angle we need to take the rest of the show.
Mhm.
It's not just
We have
COVID.
a caller, by the way.
I don't know.
Okay.
They better be on point.
Better
If
ask
they're
them what
not
they're
on
calling
point,
about.
listen, then this is the powers against us are extraordinary. And I'm not no longer doing, you know, you've been saying, and now I'm on board, is I'm not letting doctors off the hook anymore.
Mhm.
So what? They would have lost their job. You can still practice medicine and help people in another job.
Okay, guess what? Hospitals can't be open unless they have doctors.
Well, screw them. If they don't want to do the right thing, then let them go out of business.
Olivia,
I did
you
it.
need to jump in and tell your
I
story.
mean, I did it. Anyone can do it.
Right, exactly.
So,
Well, you made a really interesting statement, which was that the death rate of people going to the hospital, because a lot of people are talking about the percentage of deaths from COVID, and it's much higher of people that have gone to the hospital compared to the overall population of people that just got it, right?
oh yeah, it's
So
I
the
mean,
hospital is really the variable in there that's
it's a
the
well,
the devastating
it's
factor.
it's the inability to get early treatment.
Yeah, but the sad.
We need to stay on point. These callers better be on point.
Well, so far we've got 2, 3.
These people better be on. Listen,
What do you
I
want
got
to?
stuff
What do you
to
want to
say.
take a call about?
First, I'm talking. We're not
Well,
done talking. I'll talk another couple minutes, but you know, we have 4 callers. God damn it.
You have how
yeah,
many?
they're coming in. I'm sure it's on topic because when that many come in at
All
once,
right.
I think it's a reaction.
Okay, I don't need my ass kissed.
If you're just now joining us, I'd like to let you know that we're welcoming you to our special weekly medical radio show on News Talk 760 WJR. We are back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. After 20 years in practice and watching patients die prematurely and unnecessarily, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. We're inviting listeners to call in with your questions at 800-859-0957. Again, that's 800-859-0957. We have a lot of callers waiting to
and
talk.
before we start
And
calls,
go ahead, Dr.
you better
Collender.
be on point and you better be quick. Don't blow smoke up my ass. We have
My
things to say
God.
today, so let's get going.
Yeah, let's.
Wow, on fire today.
All right.
On fire, but we want to know, Siobhan, who's the
All
first
right, well,
caller?
let's start. We're going to start first with Chip in Macomb. Chip, what's your question?
My question is, and thanks for taking my call. I'm a 52-year-old type 1 diabetic, insulin dependent, obviously. Slightly overweight, according to my doctor. I'm 5'8", 192, and I've had COVID 3 times.
Wow.
Still have not been vaccinated. Both of my doctors, Beaumont doctors, I won't say who, obviously, have strong opinions against it as a type 1 diabetic. I don't know if it's because of compromised immune system or not. My family, because of I'm talking to them, they're like, well, geez, I don't know if I want to get it either. So my question to you is, with all the variations, all the changes, everything that's going on a daily basis that's happening, I'm not going to take it. But what do you say to people who maybe don't have the benefit of? I'm a healthy guy. I mean, I stay and I work
You're
out,
type 1
I eat right, I
diabetic.
do all the right
You've
things.
Yeah,
got a
right.
health problem.
Right.
So
I do.
Kolender mandate 1 is no more vaccines. The current vaccines have no benefit protecting you against Omicron, and I'm sure they're not going to have any benefit affecting you against whatever is coming down the stream. But this shows about the failure of your individual doctors to apply early treatment when it's simple, safe, and effective. And so as long as you have someone lined up to take care of you when you get COVID and give you the treatment you need, you're going to be fine. I don't care what problem you have, and I don't care whether you've been vaccinated. Thank you.
All right, Siobhan, we got to get quickly through this.
All
How many
right.
other
Yep.
people? Next.
So up next we have Dan in Macomb. Dan, what's your question?
Oh, hi, I've called you before. I just diagnosed 4 hours ago, so when can I start on your program? 2 symptoms started on Tuesday: dry cough, slightly elevated temperature, about 100 degrees. I'm in fairly good shape. I'm 77, being treated for heart disease, though. But physically, I'm 5'7", 125 pounds. But I'd like to meet with you as soon as I can and start on the program.
Well,
All right, well, call
guess
the
that's
call the
very
number
simple.
at the end, right? So
866 Kolender. Just call Dr. Kolender directly, and he'll see you.
but our PSA on this is, get on your supplements. Make sure your vitamin D3 is cranked up, zinc, quercetin, which is an over-the-counter herbal anti-inflammatory, and a lot of vitamin C, 3 grams a day. You could take NAC, which is another immune support supplement, and all of those things help. And then, of course, I'm starting people on ivermectin right away. No Kolender mandate 2, no testing. Testing doesn't work anymore. It doesn't pick up Omicron. So if you are sick, you get a viral syndrome, you get treated right away. I don't tell people to wait anymore and let their body take care of it. We treat immediately.
Immediate intervention. Siobhan, who do we have next? Dan, thanks for calling.
Yeah, up next we have Jim from Downriver. Jim, what's your question?
Yes, 2 comments. One, a few shows back, his ginger comment, I really respect you for that. The other one is you go in the hospital, they put you in ICU on oxygen. What's the oxygen do with that disease in your lungs? And the last one, doctor, you you can't comment on air, but Joel Wallach, Dead Doctors Don't Lie, you really should get with him. You two together.
Well, thank
It
you.
really help this country.
I'm not looking for a sidekick right now.
All right.
But as
Well,
far
yeah,
as
sidekick.
no, I'm kidding.
Okay,
Well,
okay.
so as
Oh,
far
okay.
as
Yeah. Hey,
well,
doctor,
yeah.
you're right about ginger root, though. You take care, okay?
Well, thank you. Thanks for calling.
Jim.
Ginger helped me when I had COVID. So, and my wife gave it to me, and it got better right away. So, as far, is there a question? Then we go to the next question. There wasn't a question.
Okay,
Yeah, that
well,
was just
let's-
we had some
let's go
comments.
on.
So
let's go on.
Yeah, let's jump to our next caller. We have now Dave in Windsor. Dave, what's your question?
Yes, the thing that I keep hearing an awful lot on many of the other stations is when a person contracts what you call COVID-19, they blame it on the unvaccinated. Now, what can you suggest about those unvaccinated when it's the other way around, when you can treat them with therapeutics such as hydroxy?
Well, thanks
What
for
can you
calling,
suggest
Dave.
about that?
Well, thanks for calling. I no longer care about vaccination because it's obvious to me in my observations treating people that vaccine status has no bearing on outcome as long as you're able to get early treatment for the person, follow up with them, and make sure that you're taking care of them along the way. All of the complications of COVID can be managed as an outpatient. Again, it's got to be started early. No longer should doctors be facing any kind of legal repercussions or sanctions because they prescribe these medications early. We need to be going after the doctors that don't. The 95% of doctors out there that refuse to treat people. All of you that have lost somebody, their doctor didn't take care of them and do their job. I don't care what the FDA says. The FDA doesn't treat people. You need to go and do your job as a doctor and help patients. Doing nothing, which is what everyone's been doing, that's a standard of care, is garbage.
Well said.
Thank you.
Bravo to you. I mean, I'm telling you right now, that's what I've been saying all along, is that each individual person, each individual patient needs to have their own primary care physician. You went to medical school. Nobody should override your decision of how to treat a patient. And, if this is a free country, it shouldn't happen here, that somebody should be able to step in and stop you. You've talked about the pharmacies that have stopped filling prescriptions. Shouldn't be allowed.
I've been giving and making excuses for doctors, recognizing the challenges of stepping out of the system and starting a practice, but I'm done with that in terms of COVID and prevention. If you aren't doing what you need to do for your patients, or you're not able to, then you've got to quit your job and make a job for yourself where you can do something for your patients. And that's what I've did, and I keep doing. So if I can do it, you can do it. It's not.
But how do patients know that their doctor is not taking care of them? Because I think most would assume that they're making the best choices for them as their patient. So how are they to know the difference?
It's up to the doctor. I mean, the doctor's got to make the choice. The patient doesn't know, because they don't. They have no way to know.
You know what, though? I got to jump in here. The patient is a consumer, and I hear what you're saying, but I'm also thinking about the fact that it's sad that they have to be their own advocate, that they have to seek out a doctor who's going to treat them, when you went to medical school to treat people. And this business of, oh yeah, you get COVID, go to the hospital, put you in a ventilator, and then you'll die, is rubbish. Siobhan, you have another caller?
Well, yeah, we have a few callers, so let's try and get at least the first one in. We have Lucy on the line in Westland. Lucy, what's your question?
Hi, I'm scheduled for a stress test on Tuesday and wondering if I really need it.
Well, why are you having a stress test?
Long story short, I was having my OBGYN checkup, and he was feeling my stomach, and he asked me if I was short of breath, if I had any chest pains, and I said no, I felt great. He said, check with your primary for an EKG and follow up, and I did. She said my EKG was perfect, but she said, oh, let's just send you for a stress test too. And that's Tuesday, so I don't want to have the test done if I really don't need it. I feel great.
Well,
what an absolute waste of time.
We'll come back.
We've got to come back and talk about this
Stay
on the
on
other side of the break. Again, you're listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you would like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
Okay, so we're back on Facebook Live
How many
now.
more callers do you have?
Well, we have to finish answering her question, but after that, we have two.
No,
that's really pathetic. Oh, hi, why don't you go and get a stress test? I mean,
But that kind of freaks someone out. Like, if you feel fine, why should you be sent for a test? I mean, unless there's something that I don't know here. I mean,
no,
that
you
seems kind of
don't.
strange.
You heard it just right. It's incompetence. It's cover your ass medicine.
how about passing the buck medicine?
It's passing the buck, cover your ass. Oh, a gynecologist gave the idea to the internist that there might be a heart problem for
based on what?
Nothing, based on nothing. So instead of standing their ground and going, I don't see a reason for you to need a stress test, it's let's just get a stress test, because the specter of heart disease was raised. What a joke. I mean,
Yeah, we
these
should
are the
keep her on
people-
the air too for when we get back.
These are the
for the
people,
that aren't
I mean,
on
my
Facebook.
God, what a joke.
Unbelievable. No, I mean, it just
I've had
goes to
enough
show
of
you
people.
how.
I've had enough of everybody.
No, but I mean,
You know.
really, but how about the fact that what happened to doctors that they unzipped their back and took their spine out?
Well, they unzip their pants and bent over is what they're doing.
I mean,
It's unbelievable.
no, I mean, it's not even funny, because just stop and think about the fact that,
Well, this is what people have to do. This is their choices. This is what's out there. What this person's saying is not uncommon. we're laughing and going, oh my God, but this is standard SOP. That's what
Very
this is the
bizarre.
world out there. Doctor, if you mention the word heart or anything, they're like, you better get a stress test so that their butt's covered, period.
Mhm.
And it's worthless.
So therefore, the patients ultimately are being scammed into thinking that,
Their
it's just,
doctor's good. The doctor's afraid, so the doctor did something, and instead of just saying, they may say you don't need a stress test based on no information, but at least it's the right thing to say based on wrong information.
Mhm.
But to say you need a stress test because they're afraid of the specter being raised
Mhm.
is worse.
Mhm.
Stand your ground and go, you know what? You have no risk factors. And you have, bottom line, no symptoms.
Mhm.
No symptoms. You don't need to have a testing when you don't have symptoms. Medical management's better. The test doesn't find anything.
I don't know, but I mean, people just think that they're kind of impressed with when they get sent away for whatever the test is, the blood test, the EKG,
There's a lot of people who love doctors that do tests.
No, I think there's a lot of doctors who love telling people to go and get tests.
Well, because it doesn't require a brain.
Yeah.
Well, it's a billable test, so.
And it's billable. It goes on whatever their billing formula is. Exactly. Because they work for somebody. I guarantee. Unbelievable. You had an anniversary on LinkedIn. I just got notified. Congratulations. Yes.
Anniversary for what?
4 years on LinkedIn. Congratulations.
That's all?
It's your
Wow. I thought it was on LinkedIn
Happy
longer than that.
happy
Yeah, thank you
anniversary.
very much. Welcome back to our special live medical broadcast on News Talk 760 WJR. We are fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention here tonight to give us some straight talk about two important topics, prevention and being proactive. Please tune in to our weekly shows Sunday afternoon at 3 p.m. and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, we had Lucy from Westland who was telling us about her situation. Do we have more comments for her?
Oh, geez. So, Lucy, it's
Mhm.
sad. So bottom line is, if you do not have symptoms, a stress test is not the right thing to do. It's
Mhm.
only applicable if you're having heart symptoms, chest pain, dizziness, shortness of breath, all with exertion, nausea, cold sweat with exertion. Not having
Mhm.
symptoms means you do not need a stress test.
Anyway, the stress test would be
Okay.
useless.
It's useless. A stress test is only good at identifying critical plaque, meaning plaque that's blocking blood flow right now, which should cause
Mhm.
symptoms. So getting a stress test is gonna, assuming you don't have a critical blockage, which you shouldn't because you don't have symptoms, it does not mean
Mhm.
that you're okay, because people that die from heart attack and stroke have subclinical plaque, meaning they've got active plaque ready to rupture that's not blocking flow. And that does not get picked up by a stress test or a vascular ultrasound, or can also be missed by a heart catheterization. So you need to get a CIMT, which we do in our office. You
Mhm.
need to get a CAT scan of
Mhm.
your heart to look for plaque. And unfortunately, your
Mhm.
doctor has no idea what they're doing. I hate to say it.
Yeah,
Okay.
so
You
I
need,
called.
go ahead.
Oh, go ahead.
No, Lucy, you really need to get the right diagnostic tests that
well, she needs to find a doctor that knows what they're doing, because your doctor's playing CYA, cover their ass, because the specter of, heart disease was raised by the gynecologist. So you better get a stress test to make everybody feel better except you. So you're going to get a giant deductible bill to begin the year for tests that you don't need. And God forbid the test comes back with a false positive. And then you're going to get a heart catheterization, which has a risk of death for a test you didn't need to get in the first place. So get a new doctor.
All right, Lucy. Well, good luck with that one. And you certainly are willing to available to call Dr. Kolender at 866-Kolender to follow up. Siobhan, we have a lot of callers.
Yeah, we had a few more come in too. So let's go now to Susan in Rochester. Susan, what's your question?
Hi. Last year at this time, my husband was hospitalized with COVID. He passed away on February 11th. He was a 42-year career clinical microbiologist who knew so much about COVID, actually informed the nurses and doctors of things they didn't know about it. He begged in the hospital for the treatments that he wanted. He wanted the monoclonal antibodies, he wanted ivermectin, hydroxy, all these things that he knew. He had already been taking quercetin preventatively and massive D&C and all of this. He was denied multiple times. He was told, and then he said, well, I know he was told it's not a protocol. And he said, I understand that, but I know how this works. You convene your board. I'm asking you for compassionate use. They denied him 3 times. He died.
What was the hospital?
It was Beaumont.
In Royal Oak?
Well,
It was, at first he was at Royal Oak. They discharged, he was on remdesivir. He would call me and say, this is absolutely doing nothing. It's hurting me. They released him after 8 days. All they did was steroids and support oxygen. They released him home. He was home for 12 hours. At that point, I was so sick I couldn't help him at all. I had COVID also. His oxygen was 87, so called EMS, and they took him to Troy, Beaumont, and he died.
well, we're very sorry for your loss. And I mean, there's nothing we can say that's going to make anything better other than
But how horrible is
it's
that?
horrible.
He was a
and
microbiologist. He was a scientist. He knew what medications he needed to be given.
and he's
And he was
telling
locked
the
in
doctors,
jail.
right.
He was in jail.
And back to, this kind of brings us back to where we are, which is the forces against us are great. You've got the FDA telling doctors to practice the wrong way, even though the FDA doesn't practice medicine. And you've got doctors listening to the wrong information. You've got the NIH. You've got the the figurehead of medicine on TV every day telling doctors what they should or shouldn't be doing, which is the wrong thing 100% of the time. The forces going against our ability to get healthy and to use preventative medicine and also prevent heart attack and stroke are immense. And this is what's depressing today to me, is that this legal brief I read just made me, open my eyes again, even though I know it. It's depressing to recognize it.
Okay, Dr. Kolender, before we run out of time, let's just talk about we know about the government and what the shortfalls are of the government, but this is here in Detroit. This is Beaumont. And how do you have a scientist, a microbiologist who's admitted, who has so much background in medicine, saying he wants to be treated this way? And why did they not just say, sorry, we're going to have to discharge you. Let us find you a doctor that can prescribe these medications. If he'd been in your care, he probably would still be alive. Where is the accountability of the doctors and the hospital here? Forget about the government.
She should make them accountable. Call Feiger.
Well, there you go. But
Right.
that doesn't,
And
unfortunately, that doesn't bring him back.
No, it doesn't. And there is no accountability because the hospital has been made Teflon. They can't be touched because you cannot sue anybody for COVID.
But why
but
did they?
there is-
Okay, you know what?
Well, this is today's accountability. Today is people should not be holding anyone responsible except their PCP for not being available to prescribe these early treatments. And again, I was treating people a year ago, just like this person's husband, and no one's been in the hospital. the PCP, the frontline person's responsible for not taking care of their patient.
Okay, when are we going to talk about the culpability of Beaumont Hospital for not allowing this gentleman to be discharged into the care of a doctor who, like you, would give him the medication that he knew would work? And why are we giving them a pass?
And we're not giving him a pass. Go ahead. What do you want to do to him?
No, but I
Let's
mean, it's too
line
late
him
now.
up.
No, but I mean, it's too late now. Here he's telling the hospital, the doctors, that this is what he needs to get. He's a microbiologist, he's a scientist, he's a PhD. And then they're not saying, sorry, we can't give you this medication, but we'll release you to a doctor who will be able. And then you've got all this other nonsense about not being, have pharmacists that are stopping you from filling prescriptions. What's going on here?
If the listeners have a doctor who's employed by a hospital, you basically have to leave that doctor and find an independent doctor. You've all got to, just like we're boycotting CVS and Walgreens and Rite Aid because they won't fill scripts on a regular basis. Now you got to leave your doctors. If you go to a hospital employed doctor, pack your bags, get your chart, and leave. There are doctors who are independent, who are allowed to think for themselves, who will make the effort to take care of you when you need to be taken care of, who are going to figure it out on their own. And again, I don't want to make it sound like I'm so special. I'm just someone who said a long time ago, I want to do different. And here we are. I am saying it again. I did it. Anybody can do it. And now it's up to you listeners to leave your doctors and find other people.
All right, we're going to have to take a quick break. You are listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subjects we're discussing and you would like to talk to the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR.
Okay, so we're back on Facebook.
How many more calls do we have lined up?
We have two more calls. We also have a question through the Facebook feed, but it's not related to COVID, so I can wait until you finish your statement.
No, but I mean, this is solid gold, but her story is absolute bullshit.
There's 850,000 of those stories. 800,000.
I know, but here is a guy that goes in and he's, what was it he said? That he's asking for like medical relief, or what was it they said?
Compassionate.
Why would they not allow him?
Arrogance
on behalf of whom?
The doctor.
The doctor
board,
or the hospital, which?
All of it. That somebody there could have snuck it in, called the wife, I'll take care of this. Get me the drugs, I'll give it to him. Somebody, a nurse, the doctor, the PCP, no one did it.
Okay, but
go get ivermectin, I'll order it, you get it, I'll give it to him. I'll sneak in when no one's there.
This is just, an unbelievable story. I don't think you've ever had a caller like this before. This is an unbelievable story. Here is somebody who is in the hospital, who's a scientist, who knows what the medications are that he needs, and then he's just sitting in a bed, not being allowed to leave, and not being treated, and just being told to lie there and wait till we can put you on a ventilator.
It's tragic. What do you want to do? It's absolutely tragic. And for the fact that no one at the hospital to go, I've got nothing to lose. You're dying anyway. Take this drug.
Yeah, see, I'm not quite sure how that compassionate request works. If you ask for the medication, can you then be given it when you're in the hospital?
A board convenes to approve it.
Oh, that takes too long.
Right. And again, the doctor has to leave their job because the hospital has rules that limit care. We need to talk about this on the air. These doctors have to open their eyes and go, something I'm doing here isn't working.
Mm-hmm.
I better go do a better job somewhere else. I'm being limited in my ability to be effective at my job. They got to leave. This needs to be on the air because really that's the problem. They've all bought into this person is vaccinated, they're not vaccinated, and this is the reason they're going to die. No, the reason they're going to die is because they didn't get early treatment, and you're giving them a drug that's going to kill them, the remdesivir.
Who said the remdesivir is going to kill them?
The studies.
It's going to kill them?
Remdesivir is a horrible drug, and that's the only tool available in the hospital in the United States.
That doesn't make sense.
It has no supportive data. And
So they're
Fauci
allowed-
sat in the
so-
Oval Office 2 days after a study, before a study even finished and was published, he said, this is going to work. So
You need to get over it with Fauci.
Well, no,
Nobody
but
can
you're-
reach
you're-
Fauci.
you're asking me, what is this? So I'm telling you, this is, the doctors have to leave the hospital. There's nothing that guy could have done. We got to come back to that. I don't know that we're going to get to another caller. We'll see.
Yeah, we have 3 callers now.
Oh, we got 3. That's great.
Do a fast, like a fast.
Who was their
lead-in.
name?
A fast
Susan, the
lead-in.
girl?
Just go right in. Skip the lead in.
Go to where?
Skip the lead in.
Welcome back to the final segment of our special weekly live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, we're left with 8 minutes. You've got callers piled up. Do you want to continue on in the discussion?
Yeah, because we really spent the whole time on Facebook talking about the last call and how horrible it is that a scientist is in the hospital telling the doctors what to do and they won't listen. And all we can say is, the doctors in the care should be opening their eyes and recognizing that what they're doing is not effective. I've got to leave this job and find another job or make myself a job where I can be effective.
So let me ask you a question. This patient was in the hospital. He subsequently died. He's a scientist. He's a PhD in microbiology. He's telling them what medicines he would like to receive. He's asking for compassionate care. I want to know where the doctor gets off not acting on that, the physician that's treating him in the hospital.
If it were me, I would have snuck the drugs in.
Well, that's you,
That's
but
me.
let's talk
The
about
other thing is, and I've done it. So the other thing is,
that's it. We're going to get cut
right.
off now.
And the other thing is, those doctors ought to look at themselves in the mirror and go, like I said, I got to change my job. The hospital made protocols based on faulty FDA recommendations, and the doctors are locked into the process. So the doctors need to say, I got to leave and do something different. The patient needed a doctor who's going to prescribe the drugs he knew he was going to need. Again, no blame on someone who suffered and died, but a plan needs to be in place, and listeners need to leave their doctors who are employed by a system that won't allow them to take care of them, whether it's preventing heart attack, stroke, or dementia, or diabetes, or treating COVID when it happens. If you stay in with your hospital employed doctor who's not going to treat you, it's your problem today. Because I'm telling you, you need to leave.
No, it's
The
not.
system's
Wait a minute.
horribly
I'm going to stop
corrupt.
you. This is the country's problem. This is the insurance company's problem, because people are getting bled to death by pharma and by the insurance companies, and most people don't know where to go.
Well, you just asked me what's the individual supposed to do. Well,
I
they
understand,
can't
but you know
fight
how
the-
hard. I understand they
they
can't fight
can't
the
fight
system
City
as
Hall.
it is, but
So they got to leave.
finding a doctor like you that specializes in prevention, that's like finding a needle in a haystack.
All right, let's go to the call. So
Okay, we'll
just
go to the
you and
calls
me
and quit
bickering.
arguing.
Let's get some callers in. Okay, all right. So up next we have Greg and Shelby. Greg, what's your question?
Hey, Dr. Kolender, I love your candor, Mr. Positive. Hey, I'm going to be real quick. You are so controversial. What did you think of Joe Rogan? You are a gentleman in the same vein as that, which you are looking at both sides of the story, both sides of a situation, and I just love your candor. More people have to know about you.
Well, thank you.
What do you think about, real quick, Joe Rogan? Was he maligned?
Well, I honestly don't listen to that podcast. I don't have time. It's too long, so I just get snippets of it. But in general, on his COVID thing, I would agree that we probably have a lot in common there. But that's all I can say based on what I've heard, which is not more than 5 minutes of anything he said at one time.
Okay, good. Here's my opinion. He's not an MD after his name,
Right.
so he needs to stick to his job as a broadcaster, as a podcast guy, and keep his nose out of being an MD. So let's go on to the next
Thank you.
question.
Okay, you got the AnnMarie opinion there.
Okay.
Okay, up next we have Joe in Westland. Joe, what's your question?
And enjoying your program. But anyway, my question is, I've never taken a vaccine, and I've been prescribed ivermectin and hydroxychloroquine as prophylactics. And I'm wondering if I ever have COVID symptoms, what's the usual dosage of the ivermectin, and can I take it along with the hydroxychloroquine?
Well, good question. So the dosing is 0.4 to 5 milligrams per kilogram of ivermectin per day. So depending on your weight, it'll be more or less. And it's for 5 days,
Okay.
and you can get a refill. You could do it for 10 days if you need to. I've not had to prescribe it for more than 5 days on only 1 or 2 occasions. Omicron's been pretty mild, so I've not been using hydroxychloroquine with Omicron as a routine, but some people have required both. So it just depends on the person and what their course is and how it's going.
But he also needs an MD to
So
write the
you
prescription.
can take
He's
both
got it.
together if you want.
You can, and I prescribe them both together depending on the person.
All right, we're going to have to go. We have one more caller. Siobhan, who's the caller?
Yeah, so we have up next now Joe in Canada. Joe, what's your question?
Yeah, I'm just wondering, you're talking ivermectin. Like, there's a lot of farmers that probably have it. Can anybody just go and ask a farmer for that stuff?
Well,
Ivermectin?
no, there is human grade ivermectin and pharmaceutical. So there's a standard for production, United States Pharmacopoeia USP. So you want to make sure that you're getting the proper grade drug for humans. So I would still recommend again from a compounding pharmacy that uses it for that means. It gives it a bad name.
Okay, Joe, thanks for calling. Dr. Kolender, we only have a couple of minutes left. What is your advice to the listening audience tonight?
Well, today, really, the take-home message is we're not letting doctors off the hook for their circumstance.
Or hospitals.
Or a hospital. Well, the hospital's a hospital. The doctors are choosing to work there. And up to now, I've been very apologetic to doctors because they are stuck in a job. Well, guess what? You're not stuck in a job. You can quit and you can leave and you can get another job. Hang your shingle like the good old days and market yourself that you're going to treat COVID. And guess what? You're going to be busy pretty quickly because no one's willing to treat COVID around here. So you're going to save some lives and keep people happy and generate, some goodwill. You cannot hide behind the FDA. They do not know what they're doing. The FDA is a mess. Nothing, in my opinion, if the FDA approves it, it's probably bad. And I felt that way for years. We've said on the radio all the time here. So nothing's changed.
No, but I mean, the average listener, the average patient out there who's listening to this show, they're just looking for a shepherd. They're just looking for an intelligent, educated doctor who's going to treat them if they get sick, be it COVID or whatever else.
Well, you've got it on my number. You can call. Don't go online, find me, but you got to call the number. And unfortunately, there just are not enough doctors in Metro Detroit because this area, all the doctors sold their practices to be hospital employees, and which was a bad decision for you as a patient because now they're stuck with hospital rules. And that means you are stuck with a doctor who isn't willing to do what you need to do They're just collecting their paycheck. So leave them and find somebody who's going to take care of you when you need it to be taken care of.
Sad that they all have to be proactive and they all have to
Prevention.
go into find a doctor that practices prevention. Well, unfortunately, we're out of time, so I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Thanks to my co-host, Siobhan Cronin in Miami, Florida. Please continue to tune in to our shows Sunday afternoon at 3, Thursday evening at 7 for the latest medical updates. And thanks for listening to News Talk 760 WJR. Good night and be well.